9 in 10 staff in care homes for older adults have been vaccinated with at least one dose. Let's find out what the situation is like. More than 8 in 10 have had 2 doses. Adam Purnell is from Keppelgate Care Home in Poulton, and he's live with us this morning. Good morning, Adam.
Morning, Graham. How are you?
I'm all right. Thanks for joining us. So, am I right here? From the 11th of November, if you are working with residents in a care home, you've got to be vaccinated?
Yeah, so first, can I just say that Sajid Javid is our Health and Social Care Secretary. He's not just our Health Secretary. He represents both sides of the fence. It's a mistake the media quite often makes in just relegating him to health and ignoring the social care aspect. I'm part of the Challenge Diane campaign, so I just had to say that. So yeah, from the 11th of November, it's going to be made law. It's written into the Care Act that people have to be, and it's not just care workers, it's anybody coming into the home other than relatives and emergency services, have to be double vaccinated to enter that care home by law.
To a lot of people listening, that sounds like a good idea.
It is, until you start considering that it's going to be your carpet fitters, it's your aerial fitters, it's your delivery drivers, it's absolutely everybody, and there's still no current plan to safeguard the delivery of services to care homes. You know, he's talking about this 30,000 people who are most probably medically exempt. I'm part of 4 different care networks, which in total probably have around 10,000 managers and providers in, and I've only ever seen probably 5 medically exempt letters been given to providers. There's not many providers out there who have received these medically exempt letters. And I also think it discounts the fact that there's a number of people who've left the sector actually before November 11th comes. So those figures themselves are going to be skewed as well.
But it does sound like that, like more care home stuff are being done. You know, and if you are working in a care home, you've got to be a particularly, a caring person. It's a hard job, isn't it? It's a very hard job. And this is just another level of protection to look after the people who you're caring for.
Honestly, Graham, I completely agree. And I would, I'd advocate for anybody to get the vaccine. It's just when our Health and Social Care Secretary wants to sit there and reference care workers as people who just go into a care home, wash, dress and feed people and then go home, there seems to be a huge disconnect of what it actually means to be a carer. So my biggest fear is people will be listening now, and as they have been doing for the last sort of 18 months, going, oh, what an awful sector. It must be so stressful to work there. And you know what? It is. But that's only a small portion of it. The actual role itself is one of the most wonderful roles someone can do. So I would hate anyone listening to this now to think, oh, I can't go into it. It's too stressful. I'm not going to manage it. It's actually those people that we need to come in now to relieve that stress. Those people who want to make the difference, who want to care, who want to protect our most vulnerable, whether it's our elderly, whether it's our learning disabled, the whole spectrum of care we want to support. So we need those people to come into it. And it is an added level of protection. There's just no safeguard of where we're going to get the workforce from because it is nationwide. There are no people wanting to come into care.
Yeah, and there's the same issue with nurses as well, with GPs. We're talking about there's going to be all this new money for GPs, for locums, and GPs I've been speaking to going, yeah, that's good, but I don't know where I'm going to get them from. It is particularly in care, would maybe offering people more money attract people into care? Because it is a bit of a sector where the pay for the responsibility isn't great.
Yeah, so I'm a huge believer that care workers, the basic level care workers, should we say, not to be disrespectful to them, should be on at least £12.50 an hour, period, full stop. It's a demanding job. It is an emotionally demanding job. It is a physically demanding job. And it is something that they need to be rewarded for. However, when I advertise for a receptionist and I advertise for someone to come and work in a caring role at the same rate, and I get 30 applicants for a receptionist and only 2 applicants for the person in the caring role, there has to be more to it than the money. It has to be around the public sector's image of of social care, and that's something I'm working to do. And the government have this mindset that let's just throw money at people. So I think it's 162 million or something they're giving to us for recruitment and retention in social care, but without a plan. It's money doesn't fix situations. You can't just go, here's 162 million pounds, that's going to fix your recruitment issue. No, it's not. What we need is a well thought out, well laid plan by the government, created with people working in social care and people using social care services, so that we can change the sector and entice more people in, not just throwing money at a situation.
And you say we haven't got that plan yet?
No, there's been nothing. Absolutely nothing. We got an impact assessment when they first announced the mandating of the vaccine, and since then there hasn't really been anything. And that's part of what I'm trying to do moving forwards now is create something sector-wide, nationwide, to help bolster the workforce in social care.
Adam, always great talking to you. Thanks for joining us this morning. Adam Purnell, manager at Keppelgate Care Home in Poulton. 18 minutes after 7.
BBC Radio